the SBC Working Group Secretariat. This two-day forum will be simultaneously interpreted into English, French, and Portuguese. If you have not already selected your language for audio, instructions on how to do so will be added into the chat box. And as a reminder, our interpreters Camilla, Tatiana, and Marcos are all on the line to provide the interpretation. And a reminder to our presenters today, please remember to speak slowly for our interpreters. As a participant, your microphone and video are not enabled. We encourage everyone to engage with each other and the panelists by submitting comments using the chat box, which is located in the toolbar. And if you haven't done so already, please introduce yourself in the chat box by typing your name, your affiliation, and your country so that we know who all is joining us today and where you're joining from. We also have a separate Q&A box. As we move into the technical presentations today, we encourage everyone to use the Q&A box to submit their questions. You're welcome to type in whatever language you choose in the Q&A box or in the chat box, and an interpreter or steering committee member will be able to translate it. Slides for today are available in English, French, and Portuguese, and I think that the link to access those slides, yes, it is on the screen, and we will also share that in the chat box. Throughout the forum, the Secretariat will be sharing our screens, and the slides will be shown in which the language the speaker is presenting. So please follow along using the slides in your language in a separate window. Thank you again for joining today. There is fantastic representation. We have members joining from Zanzibar, Guinea, Nigeria, Ethiopia, Niger, Mali, and Guyana. Thank you all for joining. As always, it's great to have so many of you with us. And we have a full agenda, so let's go ahead and get started. To start off our virtual forum, we would like to begin by handing the floor to the co-chairs, Gabrielle Hunter and Miriam Wamala, to open the program.
Hello, good morning, good afternoon, good evening. On behalf of Miriam and myself, we are thrilled to welcome you to the RBM SBC Working Group Virtual Forum. As we all know, 2020 has been a very eventful year, and here we find ourselves in a very different situation than where we were just 1 year ago when we last came together in Maputo and were welcomed by our Mozambican hosts. The entire world is facing such a serious situation with the global COVID-19 pandemic, which is leaving a host of problems in its wake. And among these are very real threats to malaria programs. Modeling is showing us that malaria deaths could even double in 2020 as a result of the challenges in care seeking and managing cases and other issues. I think this is an important time for us to remember that SBC always has and continues to play a crucial role in malaria prevention, control, and elimination. For this reason, while we are not able to meet in person as a working group this year, it's more important than ever that we maintain the momentum of our hard work and our network of SBC professionals vibrant. And that's the reason that we have worked hard, thanks so much to the Secretariat team, to make this virtual forum, Maintaining Momentum, a reality. We've got technical presentations, key updates, and interpretation in 3 languages, and hope you find the program interesting. Thank you so much for connecting across the social distance with us today as well as tomorrow. We have a very timely agenda that we think will spark good discussion about how we can continue to improve our work in this new context over the next year. It's hard to feel connected when we're not together physically, and it's tempting to multitask while we're at our computers, but we do ask for you to view this opportunity to connect with colleagues, ask questions that come to mind, as well as share all of your comments and thoughts that are provoked by the presentations and discussion. In short, please engage with us and your colleagues. There's the chat box in Zoom. We also, of course, have Springboard, another great platform for networking. We, likely will not be together again for possibly another year, so we'd love to make the most of this opportunity. The chat box is open and so is Springboard. Thank you again for making the time to join us at this virtual forum. It's important for us to maintain the momentum of our work. And a very big thanks to our Secretariat team for organizing this meeting. It may not seem like a lot of work, but it really has been. Without further ado, we are happy to begin the program. And to start the meeting, members of the steering committee will be providing a few updates. So we will begin with Deborah Freitas Lopez. Deborah, over to you to get us started with some important updates from the working group.
Hello, everyone. I was asked to present in English, but I also speak Portuguese. I wanted to share the Regional and Linguistic Ambassador Program that we are excited to present and initiate starting at this meeting. As we shared through the expression of interest call. The purpose of this program is to build and maintain engagement and increase regional and linguistic representation in the working group. And in particular, we will start with our Lusophone and Francophone colleagues throughout Africa. The aim is to eventually expand to Latin America and the Caribbean and other malaria endemic regions. With the program, we have ambassadors and then also points of contacts who are focal points between the steering committee and the ambassador group. And I am one of those, and Jean-Jacques is the second. I will be the point of contact for the Portuguese ambassadors, and Jean will be the point of contact for the French ones. With the expressions of interest, we received multiple submissions, and thank you for all of you who were interested. And as a result, we selected 4 Francophone ambassadors and 1 Lusophone ambassador. Next slide. For the Lusophone ambassador, we would like to welcome Seju as our representative. He is from Mozambique and works for the National Malaria Control Program. We do have 1 more vacancy, and if you are interested, please contact the Secretariat, and Lizzie is sharing her email address with you. Next slide. And we have 4 French ambassadors from Madagascar, Mali, Burkina Faso, and Guinea. And they represent a range of members from the National Malaria Control Program to also in non-governmental organization representation. So we want to welcome you and thank you all for volunteering to take part in this program. Jean, do you want to say anything?
Yes, hello, my name is John, and I am a Francophone point of contact for the Secretariat. And I am very happy to have our ambassadors, Francophone ambassadors, Jemima from Madagascar, Ibrahima from Guinea, Mori Kamara from Mali, and Ida Savadogo from Burkina Faso, and Jehad is going to come in contact with you, and they're going to reinforce the communication of the group. And please welcome them with me. Welcome them to this program. Thank you, and thank you to the ambassadors.
Okay. Well, thank you so much. And Lindsay, I think we can move on to Don.
Yes, over to Don for our workstream update. And I will hand it over to Ashley to introduce our next presentation.
Thank you, Don, for that great update on the Transmission Zones work stream, and thank you for introducing me, Lindsay. We're happy to see over 100 participants on today's call and from so many locations. We have Zambia, Ethiopia, Sierra Leone, Tanzania, Malawi, Singapore, DRC, Ghana, Nigeria, Mozambique, Guyana, Cambodia, and so many more, like Mali, Liberia, Zimbabwe, Kenya, India, Guinea, Angola. I could go on and on. This is wonderful representation. Thank you so much for joining. I'm excited to transition now to the technical portion of the virtual forum based on malaria SBC during COVID-19. Today and tomorrow, we will have 5 presentations by SBC working group members on maintaining the momentum of malaria SBC throughout the circumstances of COVID-19. Today, we will hear from 3 presenters on Facebook campaigns in 10 sub-Saharan African countries and Guyana, social mobilization in Guinea, and an IT and mass distribution in Zanzibar. Tomorrow, we will have 2 presentations on digital and alternative messaging channels in Angola and integrated ITN and SMC campaign in Nigeria. There will be a question and answer session after today's 3 presentations. Please use the Q&A button at the bottom of your screen to submit questions during the presentations. As a reminder, the slides for each of these presentations are available in English, French, and Portuguese. The link can be found in the chat box. To our speakers, please remember to say next slide, and I will advance the slides. Now I will pass the floor to Anna McCartney-Melstad, our first presenter. Anna, welcome to the virtual forum.
Thank you so much, Ashley, and welcome to everybody. And it's so exciting to be with you all here virtually. What a year it's been since we last met in Mozambique. And you know, it's been incredibly long, but I think we've also learned a tremendous amount. So I hope that everyone is coming today with healthy families and you know, renewed energy, because I think the battle for malaria in the last year has been extraordinary. And I think that a lot of the experiences that we're going to hear about over the next few days are going to really show the strength of our malaria SBC community. So I'm here today to talk a bit about a Facebook campaign. And this, can you go to the next slide, please, Ashley? Yeah. As I'm sure we're going to hear about from many over the next few days, COVID has really challenged malaria in a number of ways. And one of our key behaviors for malaria is seeking treatment for fever, seeking care for fever within 24 hours. And as we all know, COVID and malaria share a key symptom, which is fever. And so I think it was no surprise to the malaria community that we are seeing decreases in care-seeking behaviors across malaria endemic areas of the world. There was some projections done that showed about an anticipated 45% decrease across 18 African countries. There were some projections that malaria deaths could double. And, you know, we've heard from this community and we've heard from folks on the ground that there's a number of reasons about that. So like I said, the overlap in symptoms between COVID and malaria is great. And, you know, along with COVID-19, there's fear and there's stigma, both about getting the disease, being exposed to the disease, being diagnosed with the disease. And as a result, there have been far fewer people in many countries going to CHWs and health facilities when they have fever or their children have fever. So there's stigma around the disease itself. There's fear that if I become, you know, if I'm actually diagnosed with COVID, I might be quarantined. I might have to pay for that quarantine. I might never see my family again. All very understandable issues. And then with the social distancing requirements, it's much harder to reach people with SBC campaigns. And we know that there's a number of individuals who are self-diagnosing and self-treating for malaria. Next slide. So Facebook, in a partnership with the President's Malaria Initiative and Malaria No More, saw an opportunity. They knew that, of course, there's many health issues that arose during COVID, but because of the strategic partnership between PMI and Facebook, the Breakthrough Action Project, along with a number of other partners, including Rollback Malaria and partners across the African continent, were able to take advantage of a really interesting opportunity. And that is to leverage Facebook in a way to be really responsive to this crisis and the reduction in case management care seeking. So this partnership had a number of components. So one was capacity building for staff and others running Facebook accounts. And all of these training sessions are available to everybody. They were all recorded. And there were a number of training sessions to familiarize ourselves with how to effectively use Facebook in a time like this. And in addition to that, there were videos and customizable templates that the Facebook partners created that could be, you know, made very localized to our contexts and then published on Facebook accounts. There was also, besides the mentorship and besides the creative campaign materials, there was also a small token of ad credit from Facebook. And I think one thing that we learned is in a lot of our African countries that a little bit of credit goes a long way. And we were able to get some really great numbers out of it. So the campaign was called Seek Care for Fever, and it's ongoing through the end of this month. But it was really to bridge that gap of care seeking during a defined amount of time, so August through October. And so this campaign was developed. There were tailored messages in English, French, and then local languages. And it was really focused on this care-seeking behavior, getting tested for malaria within 24 hours of fever. The COVID messaging was quite discreet, quite understated, you know, as per the guidance for the COVID and malaria SBC guidance that had been developed a few months ago. Health workers were seen wearing masks and social distancing. They were modeling what behaviors should be done in order to protect oneself from COVID. It was also adjusting expectations for what people might see when they go to the clinic with a fever that they suspect is malaria for testing. So a lot of those, it was not such direct communication around COVID, but rather really focusing on getting folks to the clinic and what they might expect when they get there, how things could look differently, and reassuring people that clinics are not necessarily a place where they are going to actually be exposed to COVID because of the measures that they were taken. Next slide.
Sorry, Anna, to interrupt. We've learned that there is a problem on the Portuguese line. So just before we move on, Marcos, if you could try moving your mic closer to your mouth so that we can hear you a little bit better. I think that our colleagues would appreciate that. Thank you.
Okay, I can continue. I can go slower if that's helpful. Is it working now, Lindsay? Okay. Okay, great. So most of us on this call are SBC aficionados, and I think that all of us recognize that a social media standalone campaign is not good SBC, that social media materials could and should be, in many cases, part of a more comprehensive SBC campaign that's a process that follows the right steps. And so in this case, it was, a Pan-African campaign that was really leveraging this opportunity or addressing this opportunity. But in general, I think that the consensus in the SBC community is that social media should be a part of a much broader, more comprehensive branded efforts instead of a standalone. Social media can complement and reinforce the other mass media and the on-the-ground work. And in this case, it was really key because there were social distancing guidelines, people were sheltering in place, and Facebook was one of the few channels, excuse me, that was fairly easy to access. We do know that some countries have limited Facebook users, but I think that something that we learned as well is that there are more Facebook users than perhaps we had given credit to previously. Can you move the slides forward?
One moment before I go to the next slide, it sounds like we're still having some Portuguese interpretation issues with the sound quality. So Tatiana, if you could please take over for Marcos, that would be great. Again, Tatiana, please take over for Marcos. People are having trouble understanding the Portuguese translation and aren't able to listen to the presentation. Back to you, Anna.
Okay, thanks. Thanks, Tatiana. So I'll present a few data points and then talk just a little bit more broadly about the campaign itself. Sometimes these big numbers can feel kind of overwhelming, but in a very short amount of time, the 10 countries and their partners were able to reach nearly over 4.5 million Facebook users. And so I think that this is, like we said, a great tool to reach a lot of people when other means of other kind of SBC activities are not feasible, like during COVID. So across the y-axis are the countries. Can you move the next slide, Ashley, please? So just to say, and I mentioned this before, some countries have far more Facebook users than others, but just to point out kind of the spread, 9% of Facebook users in DRC were reached by these campaign materials, all the way up to 65% of Facebook users in Sierra Leone. And the costs for this were under $1,500 per country. So while we fully acknowledge that some countries have less penetration when it comes to Facebook users, you can cover quite a bit of ground depending on the country. I mean, obviously DRC is a massive country. Sierra Leone has far fewer people. But just to underline this fact about Facebook being very strategic tool that one might use. Okay, can we go to the next slide? Thank you. So beyond just reaching people, we know that we know as SBC professionals that engaging the users is much better than just simply blasting out the messages. So we were, I think, impressed that a lot of the content did generate some of these engagements, which would be likes, shares, or comments. And so on average across all of the countries, we had about an 8% engagement rate, which Facebook tells us is actually quite high, which indicates that, you know, in general across these countries, Facebook users at this time were really interested in interacting with information about malaria in the context of COVID. So I think that that was something that was really interesting. Next slide, thanks. So the characteristics of the content that was the top performing content. Videos tended to do quite well if they were not too long and not too short. And we know this by playthroughs. So playthroughs are videos that were at least played partially through. The videos that we would put up, which were customizable into the languages, the local languages, tended to do quite well. Also, the content that featured local faces, real people from the communities and the countries got a better response than generic graphics, which we know is just good SBC, good targeting, and good audience reflection. And then also content that specifically asked users for their response. For example, Sierra Leone asked for people, photos of people wearing their masks, did really, really well with much more engagement than one might anticipate. So, you know, I think that there is an opportunity in this epidemic for engaging people with social media. Next slide. So as I mentioned, this is an example of a short video which Facebook partners had created for us to use. This was from the Nigeria page, but many other countries had similar, similar materials. So this was a 17% engagement rate. And this was a short video about making sure that, to bring your children to the clinic. And it was very cute. And it was less than 1 cent per 3 plays. So every time somebody played a part of it, it was less than a penny per person, which I think is a really, you know, cost-effective way for reaching people at least, and knowing that they're actually engaging with the content. Next. This content, and this is from Breakthrough Action Ghana, but other countries had similar content, like I said, reflecting local logos, local you know, slogans and faces as well. This had a 32% engagement rate, and less than a penny per engagement as well. And we see that the ages for this engagement in Ghana were actually a bit lower. So some of these graphics might be a bit hard to see, but you can get a tremendous amount of data through Facebook, and that's another learning that we had. Next. So this piece of top performing content featured a community health volunteer in Kenya who was nominated by the Impact Malaria Project. And it was a community volunteer hero. And so she's a real person, and she is exhibiting some of the positive COVID protection behaviors. This ended up having a 38% engagement rate. In Kenya, we were very targeted in the messages that we sent out to be only around the lake area of the country, which was having more problems with increases in malaria and decreases in care seeking. So people were seeing people from their communities and others you know, reflected in their Facebook feeds, which was fun. And so that was about 2 cents per engagement. Next. So what's next? So we can expand these social media messages, take the skills that we've learned and take the, you know, progress that we've made expand into IPTP, attending AMC, sleeping under an ITN. I think what we've learned is that it complements and adds value to SBC programs. And while reach and engagement was strong, we know as SBC professionals that reach and engagement don't necessarily change behavior, and that more impact on that care-seeking behavior after exposure to those messages needs to be evaluated. Next. Okay, so some of the countries have already gone forward. In DRC, they're already moving into IPTP. And they've already had significant post-engagement on where and when people can obtain IPTP. So I think this is an indication of success going forward. Next. And in Niger, the SMC campaign was ongoing simultaneously. And so a lot of the content that they developed for that national campaign was able to be pushed out with the skills that we learned and the ad credits from that, from the care seeking campaign. Next. Oops, I think we went backwards rather than forwards. Thanks. So what are our take-home points? And I think I'm out of time. Content has to be tailored for the local language and people, etc. So although the content was generated at a global level, it really needs to be tailored. And we know this as SBC professionals. So anytime you use something that's prefabricated by Facebook or another social media campaign, you really need to localize it. And it's best as an adjunct to a broader SBC program, which has already identified the psychosocial factors that influence the malaria behaviors, so the content can be more effective. If you find that people don't feel like they have the power to access IPTP, for example, then you could make a really nice social media program around, increasing people's confidence to do that. And use Facebook's built-in advertising tools to target your audience. So we targeted by geography, language, marital status, education level. You can really get into the audience segmentation that we know as good SBC professionals we need to be doing. Like I said, exposure is good, but interaction is much better. And your social media plan should consider how to, should consider how to evaluate changes in the behavior itself. Next. Yeah, so I think that's it. So I think there will be opportunities for questions later, or I'm happy to answer any questions in the chat. Thanks, everyone.
Thank you so much, Anna, for that wonderful presentation. It sounds like social media is a really wonderful tool for malaria SBC, especially during the COVID-19 pandemic. As a reminder, we have a question and answer session with all presenters later today, but feel free to submit your questions in the question and answer box now. Thank you to everyone that submitted questions. Tatiana, I just heard you speak in Portuguese, but I'm going to continue in English. Now I would like to welcome Teresa Marema to present on an ITN mass distribution that was held in Zanzibar during the pandemic. I will welcome Mama Duba, who is joining us from Guinea to give his presentation on his SMC work. As a final reminder, his slides will be shown in French, since that is the language he will be presenting in, but you will hear the English audio and you can download the slides from the Google file. The floor is yours, Mama Duba.
Hello, everyone. It is a real pleasure to be able to show you the activities on social mobilizers we did that helped to reach our objectives in our campaign SMC in the context of COVID-19. As you can see here in my first slide, these are our activities of SBCC and social mobilizer and our campaign of SMC campaign in the context of COVID-19. As you can see, we have a campaign of seasonal malaria chemoprevention. And how did we adapt the SBCC activities in the context of COVID-19? What are our CBCC and social mobilizer strategies used? Our social and behavior change communication, our social mobilization, and the analysis of communication channels during SMC. Next slide, please. Here, as you can see, the campaign in the context of COVID-19 was very important because of this context of COVID-19. And it was important for key malaria prevention activities. Morbidity, mortality rate, high pressure on health, and these in times of the crisis of COVID-19. It was an essential activity in reducing child mortality. During COVID-19, we had special measures taken by Stop Palu to protect the health of all concerned, distributors, supervisors, but also for communities. Next slide, please. To be able to do our activities, we had a question for ourselves: how to adapt the SBCC to SMC activities in the context of COVID-19? So despite this COVID-19 pandemic, two strategies have been chosen and implemented in the Kundara Health District. First, the social and behavior change communication, and the second, the social mobilization, whose role is to promote ownership of SMC by countries and communities and build trust between health workers and communities in this period. Next slide, please. Here you can see the strategies used for SBCC. Dissemination of 138 press releases by local communities, radio, to inform communities about the progress of SMC campaign, the period, the target, dates of visits, and places of distribution. We also have the organization of 8 round tables in local languages to explain the benefits of SMC during the period of high malaria transmission, and inform heads of households and children caretakers about the general understanding of malaria. We have also produced 10 interactive programs, debates with telephone calls from the audience to collect concerns, comments on communities who are not reached by the teams, and to respond on potential rumors about CMC in the context of COVID-19. Next slide, please. So to be able to promote our activities, we also had this campaign in the municipality of Kundara, Mandinadian, and the rural municipality of San Bailo, Pacaye, that is a borderline community. Next slide, please. We also did some social mobilizer strategies used, and that were the community dialogues. Give clear information on SMC, education of children's caretakers to accept SMC, and we also gave information on COVID-19. Next slide, please. Also, to reinforce our campaign, we have used these strategies of social mobilizers, and you can see them here in the pictures. To your right, an activist meetings, but because of COVID-19, we had to change location and we had to respond the concerns about COVID-19. So you can see on the image to your left, people that were thinking about new solutions so that we can find solutions in this new locality. Next slide, please. And here, let me see how to do it. Okay, here you have an analysis of the percentage of households informed about SMC in 2020. Here you can see the health centers that are represented here. And if you go to the Kundara community, you can see that for our first phase, we did an analysis. And we knew that 43% of the households were informed. And after the evaluation, you could see that 100% of the households were informed. 100%, as you can see. As San Barrio, you can see a decrease. In Camagüey, you can see 100%. As Saremboda, you can see 100% also. And what gives us a total for Kundara of 96%, as you can see. Next slide, please. And to conclude, we also did an analysis of SBCC channels during SMC. And as you can see, we have number 3 and number 4. You have different channels used. For example, the social mobilizers represent 32%, radio 20%, community 25%, and the religious content 23%. And others 3%. Others mean other channels. Radio was 23%, the community 26%, religious 12%, and then social mobilizers 36%. And after the evaluation, as you can see, we saw that the radio was still the percentage of 23%. The community progressed to 27%, religious 12%, and then the social mobilizers 30%. So I could say that this was what I wanted to show you for our social mobilizers. And this is what we did in 2020 during the context of COVID-19 in the province of Kumbala. Thank you very much. If you have questions, I am more than happy to answer them. Thank you very much.
Thank you so much, Mamaduba. Now we are going to, well, first I will say it was really interesting to learn about how social mobilizers could still complete their work despite the pandemic. To all of our presenters, thank you for sharing your experiences with us. Everything was very interesting today. And as a reminder, we will have 2 more presentations tomorrow. Now we will move into our question and answer portion of this panel. This will be moderated by Miriam Nabukina, one of our SBC Working Group co-chairs. Miriam, over to you.
Hello, everyone. Thank you so much for attending this very important meeting, and you've attended in really very good numbers. It shows that you appreciate our leadership. We wish to congratulate the new members on board. I would like to take you through the question and answer session for the presentations that have been made. Can I view the questions over there, Lindsay? Hi, Lindsay.
Miriam, the questions are at the bottom of the run of show document. I will share it in the panelist chat.
Okay. I think there's a question whether there's been an assessment of the most effective channel of communicating during this COVID context period for SBCC. So our presenters, one of you should be able to answer for us if this has been, there's been a way of us assessing the most effective channel that can be used over time that we can benchmark on. Yeah, there's somebody also throwing a question onto Zoidi that it looks like in your presentation, the pictures that you are having for us, the people in there are not actually observing any of the COVID regulations out there. So you could tell us, because I've also seen that. I should have been one of the people asking that question.
Hi, Miriam. Let me just chime in here for a moment and note that we have put all of the questions into a running document we've sent you the link to. And actually our first question, we wanted to start first with the questions for Anna on the Facebook work, and then we'll move into the other two presentations, just to make sure we have enough time to cover a few questions for everybody.
Gabrielle, do you mind just running through those questions?
Absolutely.
Sure.
So we wanted to start, Anna, for you. A question that came in from, actually a question that came in from both Lamine and Tonga about the selection of 10 countries and about scaling up. And that was actually answered already by Dawn in the Q&A box. Thank you, Dawn. So please, you can check the written answers for that, just in the interest of time. So Anna, the next question from Chukwu from Nigeria that is also seconded by comments from both Fortunate and John is around reaching, social media reaching our rural populations. So they comment that using social media necessitates skills and influencers that will amplify messages. Reaching those in rural areas with poor infrastructure can be challenging. How were you able to address this? And specifically, both Fortunate wonders, again, about the challenge of reaching rural communities, and John was wondering about whether or not SMS can be helpful in that regard as well. Anna?
Yeah, sure. Thanks, Gabrielle, and thanks, Fortunate and Lamine and co. You know, just so I can be very clear, I don't want to suggest that Facebook or social media intervention should replace other SBC interventions. I think that when we do audience segmentation, we find the channel that is best to suit the different audiences. But I do also want to caution us against having the same assumptions about rural access to social media. I think that, you know, for a number of years, it was very true that social media did not penetrate into rural areas. And in some countries that may continue to be true to a certain amount, but I think that as we became more fluent in using the different tools that Facebook had to offer or has to offer, we're realizing that there is maybe more access to social media in rural or peri-urban areas than we had thought before. And certainly it depends on the country. And in the case of this campaign, we realized we couldn't reach everybody with these messages. This was an effort to reach as many people as possible and in a very special situation. But in general, I think you know, it's one piece of a much larger SBC you know, intervention that's more comprehensive, and you reach the people that are Facebook users. And you know, I think that, you know, I think that it's perhaps growing in access and popularity in ways that maybe we hadn't considered before. I think SMS messaging is also a good way to reach people, especially during the COVID pandemic. And so I think there are different options. I think that you're absolutely right that we won't get everybody, and I think that that's okay, because I think that you know, it should be a multi-pronged approach anyway, with multiple channels.
Thank you, Anna. Next question is from Jennifer, also for Anna. If there are any insights on the sweet spot for video length, how long is not too long and not too short?
So Facebook recommends that if you develop video content, that it should be at least 2 minutes long. What we found with looking at our own data, that the video clip, we had 2 videos that were produced. One was 30 seconds, about 30 seconds or a bit longer than that. And the other was about 17 seconds. And the 17-second video tended to be played all the way through, whereas the 30 seconds, people tended to drop off after 15 or 20 seconds. So the longer the content you have, Facebook says it will do better, but it needs to be very compelling and very entertaining content for people to continue to watch it.
Thanks, Anna. 17 seconds, pretty short. Our next question comes from Angela. Anna, could you please provide some specifics on how communities around the lake region were targeted in Kenya?
Yeah, sure. So it was really so interesting. So the kind of tools that you have, if you pay for advertising on Facebook, you can get very, very specific. So we looked at the 8 kind of priority regions in Kenya around the lake, or the 8 regions around the lake zone. And, you know, this was a care-seeking campaign, so we really wanted to target parents with children under 5 years old. So we took the average age of parents in Kenya, and we selected to have the messages targeted more towards women than men. And we wanted to make sure that, you know, we were reaching folks, especially that didn't have advanced education levels, but rather we were searching to target our messages to reach Facebook users with elementary education or lower, high school or lower. And so, you know, we looked at the different kind of demographic information and really chose to be very, very specific in who we were sending the message to.
Thank you, Anna. There was also a question from Helen around the amount of Facebook credit given as an incentive. And I believe, Anna, you put this answer in the chat box?
I did.
Thank you. In the interest of time, just to be sure we have some time for questions to our other colleagues, we'll move on. But if we do have time, we'll come back to some of the other questions for Anna. Thank you, Anna. Teresia, a few questions for you on the work in Zanzibar. Again, thank you for an excellent presentation. We have a question from Naomi. She's wondering if you encountered any false or misleading information in the community which intended to cause harm, such as ITNs distributed may contain coronaviruses, or whether distributors or volunteers are spreading COVID-19 to households. So this question is really around negative rumors and harmful rumors. If you encountered any of that, how did you handle it?
Okay, thank you very much, Gabrielle and Naomi, for that question. So we expected there might be some rumors before we even start the campaign. So what we did, we engaged community leaders in Zanzibar, known as Sheha. So those Sheha are highly respected leaders in the community, and they have got high influence. So first and foremost, we orient them around the idea, what is it very important to have the campaign at this particular time, because the number of malaria cases were increasing and people were not accessing net through the available channel. So we have their buy-in. Why is it important to conduct the campaign at this specific time? But again, we assure them that those safety and preventive measures will be adhered. So shares were on our side, so they try also to convince people to take the campaign very positively. Not only that, but again, we target head of the household, those men prior to the distribution, and mainly we also tell them the importance of the campaign, but again, mainly reason about around assurance. So no, there were no specific rumors around ITN, and we reminded them that this is not the first time we are doing mass campaign. So we did mass campaign previously, so we are doing now just to respond to the increased number of malaria cases. So they did understand. So we didn't encounter any rumors in relationship between ITN distribution together with COVID-19. Thank you.
Thank you, Teresia. Another question comes from Daniel, and he's wondering about the PSAs and how you tracked them during and after the ITN distribution and what tools were used for that.
Okay, so for the time of in terms of PSA tracking, first and foremost, we develop a route plan, and route plan shows specifically in a certain day, we're gonna be at Shea X, and we're gonna be at that Shea at particular time, because we structure our intervention based on where do we wanna meet our people and our target audience, and where are they available at that time. So some of the Shea we pass by in the evening, some in the morning, some in the afternoon. So we develop our route plan according to that. So, and one among the requirements we did with those vendors who conduct PSA, they required also to share GPS coordinates, which clearly indicates that they've been in a certain geographical area as per route plan. But again, we also did surprise supportive supervision, because shares, those community leaders were involved in supportive supervision together with ZAMEP, together with the health promotion coordinator and Tulonge project, and those people are there in Zanzibar. So we did a surprise supportive supervision to see if the team was there where it is supposed to be, and the quality of delivery and all the issues around interaction. So we rely on supportive supervision. We check our route plan if it led to GPS. Yeah, that is what we did. Thank you very much.
Thank you. Our next question for Teresia is from Helen, and is interested about challenges in switching to stickers rather than pamphlets, if there was any feedback or if they were more expensive than the pamphlets.
Sticker is a little bit more expensive compared to flyer. So yeah, we did face some implication in terms of cost, but one advantage of sticker is that that particular message is gonna be on the door for a longer period of time compared to just take away flyer. So yes, we did face a challenge in terms of cost, but on the other side, we had the advantage that the message is on the door and people usually look on the door several times. So they keep reminding them on what they should do when they have the net, and some of the things around net caring, they are daily reminder on what they should do. So I can say it's a win-win situation. We encounter the cost, but again, the message is there to stay for a long time. Thank you.
Thank you. And a few more questions for you. We have also a question from Priska, who noticed there were photos in the presentation with project staff wearing masks, although community members may not have. And the question is whether there was general COVID-19 infection risk perception, in the community? And if so, did this impact the campaign at all?
Yeah, so when the COVID-19 case was first identified in Tanzania, the risk perception was very high. We had even had to delay our project, our implementation of the mass campaign. So by June, the risk perception was a little bit low, and that was again contributed by political statements and standing. So by that time, in the community, some people were wearing masks, but few of them. But as a project, we are still up to now following those precautions by ensuring social distance. We are wearing masks when we go outside for field visits, and we are sanitizing because we do not want to put the population at risk while we are implementing our activities. So in Tanzania, it's a little bit tricky because risk perception is low, but as a project, we are still taking those measures when we're implementing our activities.
All right,
Okay,
thank you.
Thank you, Gabriel. I can now move on to the next set of questions to Mamadou. Right. Helen wanted to find out why the heads of how the heads of households were informed about the SMC. That is for you. And then the other is what was the cause of the variation in percentage of the channels accessed between CPS 3 and CPS 4? And this was raised by Lemaine. To you, Mamadou.
Hello? Hello? As I was writing it on the Q&A, the variation can be explained with multiple reasons. So we had difficulties to travel within the locality. And even radio, sometimes they have difficulties to be able to broadcast because sometimes we do have floods. And because we have a campaign that is done while we are on the raining season, we have some issues. Sometimes there are communities where the equipment are not accepted. So sometimes the social mobilizers have better quality and they are also respected as leaders. So we are going to maintain the momentum. For example, if you see the CPS 4, you are going to see that it's also while we are in a season when there is less rain, so that we can actually travel. We can travel with no issues. And this is a season when we can actually see the sun, because there are some localities when if we go through the rain season, it was very difficult to access. So we used communications through different channels. And now we have, for example, different zones where we have people, social mobilizers there that can reach that population. So this actually helped reach more people, and we were also we were also able to communicate better. And this is what impacted our campaign in the context of COVID-19.
Lastly, to all of us, thank you, Mamadou. To the rest of the panelists, the team would like to know, in your experience, I think they want to understand that having used the different channels of communication, which could have been the most effective. This is what I pick from the question, if I try to understand it in details. And do we hope to conduct a kind of assessment, a kind of rapid assessment to check our SBCC interventions in terms of the pre, during, and after the campaigns?
As you can see, most channels had a positive impact. The channels that actually help the communities was the radio. Because there are communities that are very remote, so thanks to that channel, we were able to have a kind of communication with them. And we had also their impressions about our campaign, because at the beginning of the campaign, we had many risks. And as my friend from Zanzibar was saying, the COVID-19 showed other problems that we didn't think about. And thanks to Facebook, for example, people would see other things than prevent a disease. So for these communities, they thought that we came to infect them. But in 2018, we did the same campaigns. So thanks to the last two campaigns, we were able to have better strategies. And as you can see in the pictures, we created a vehicle that would actually send the messages. So for us, it has been a good mechanism to create contact with community, but also to build trust between communities and our staff in the field. And also thanks to these meetings that we had, these advocacy meetings, we were able to establish a clear view of the situation. And in each campaign, we bring our results with us, the results we learned about other campaigns. So for us, it has been a mix between different villages that were invited to these meetings, to these advocacy meetings. And we were also able to improve things and also respond to concerns. And I just wanted to add that COVID-19, as everyone said, maybe COVID had an impact on our activities, our care activities. But for us, it has been also positive because we said we are not going to leave everyone behind, and we are going to continue with prevention, especially with children under 5 years old. And now we have integrated in our campaign different activities, like, for example, home care and the seeking treatment, for example. So for us, we heard about the community told us thanks. We had very good results, and everything thanks to our social mobilizers and also the use of different channels of communication. Thank you.
Thank you. Anne, would you also like to give us your opinion in this regard?
You know, I tend to echo a lot of what Mamadou has said. I think that it's you know, highly context specific, and you know, I think that there hasn't been enough time to measure you know, everything yet. So yeah, I think that's how I would respond.
Okay, back to you, Gabrielle and Lindsay.
Thanks, Miriam. It looks like we actually have about 5 more minutes, so we can try to answer at least one more question. We have another question for Mamadou. This is from Jemima. How were the different local habits and customs considered in the implementation, if at all? Mamadou, if you could answer that, and hopefully we'll have time for one more question after that.
As I was saying, for us, we are already a very known project in the region. We were distributing the nets, but we are also on the field. We are a very respected partner for them. We have our place in the community. We have different approaches that we have developed. But we also go to the communities and we listen to them. What do they need? So that's because we are collecting information from them. And that's why we were able to be cherished in the communities, because at the beginning we were refused, we weren't accepted. But thanks to our campaign and thanks to the percentage of net use, for example, in our communities, and communities started seeing that the number of children that were sick was decreasing. So that were our answers, that were our success, and that was showing the community through the use of the communications supports that we were using. They were able to see that we were a good partner and that we had great campaigns. And now the context is different, as we said earlier. Our agents were in on the field with the masks. They had the sanitizer. They were respecting all the protocols of the COVID-19. But thanks to all that, we had our campaign with no risk of infection. And that was a satisfaction for me, because we weren't infecting the communities, because the communities were thinking that maybe if we were accepted, we were having they were going to have problems afterwards, but no, we didn't have any problems. So that was a very good point. So every time we had a campaign, we were discussing with all the partners, with the social mobilizers, the coordinators, people who were on the districts, and we were speaking about how to improve our campaign and how to reach more people and minimize the conflict between health agents and community. So for us, it has been a good implementation. We didn't have any issues. Et on a eu, we had a very good collaboration with communities, with the president of district, the chief of the sector, the responsible for the field. So we were able to see the whole field, and we didn't find any of these difficulties because we were ready for them. And we were able to do it during this context of COVID-19. So we were able to do it and to continue with our campaign. Thank you.
Thank you. We will sneak in just one last question. This one is actually for Teresia on the Zanzibar presentation from Anna. If there were any ITN hanging in use rates that you can share coming out of the campaign. So again, there's the distribution and all that goes along with that with regards to SBC, but then of course there's also the behavior that we seek to promote at the end of the day around making sure that people hang and use their nets. Teresia, anything you can add on that point?
Okay, thank you very much. At this point, no, we were not able to track net hanging and net use, but we will conduct omnibus survey in which we might be able to include those questions around net hanging and net use, so as it can give us a picture of the success of our campaign, specifically for what we promoted during and after net distribution. So at this point, no, we just have the number of the net distribution. We might be able to have those numbers later as we are moving forward. Thank you.
Okay, thank you. So as we wrap up, there are a number of very interesting comments and questions in both the chat box and the Q&A box. And we would encourage you, everybody, and not just the presenters, to continue that conversation, answering the questions or adding your comments. There's a really interesting question from Helen asking the whole community here connected today if anyone has been talking about managing solid waste with all of the PPE that we are using. So interesting discussions and dialogue for us to have. Please continue that in the chat box. And at this point, we will move on to the next portion of our agenda, as we have just about 10 minutes left before we close up for the day. So our last, one of the last items we wanted to discuss before we close for today is to share some new resources that have just come out. So once again, thanks everybody for the very interesting COVID presentations. We have a few resources we wanted to share. These are strong and easy to use resources for all of us working in malaria SBC. We have, this is what's new since we've last met. I think many of you will remember the Malaria Indicator Survey SBCC module that was started by this working group 2 years ago now. We are happy to say that the module is posted on the DHS website now. It's available for public use. Countries need to request it during the questionnaire design phase in order to have it added as part of your malaria indicator survey. And do be sure that, that you, as the SBC focal persons in your countries, are engaged in in-country discussions when it comes time to planning these surveys, so that you can advocate for using the module, but more importantly, help the team understand how the results will be used by your country when you have the data in hand. So please check this out. This resource is available in English and French. And of course, as always, we'll circulate all of these links following the call. We also, back in April of this year, developed a program guidance in the context of COVID-19 specific to malaria social and behavior change work. You may recall we also were able to share this resource on a webinar. This resource is also available in English and French, and we welcome any inputs into it as countries use it and learn from their work during the COVID pandemic, because we can certainly make updates to this document to reflect your experiences. So please do be in touch with us. And the last resource on this slide is a template and guidance for national malaria SBC strategies, also available in English and French, and very soon in Portuguese. And I will actually pass the floor to our colleague, Mike Toso, who can tell you more about this last new resource. Mike? Thank you, Mike. So these are our latest resources, and just a reminder, they all complement our existing suite of resources that you see on this slide. You are all very familiar with all of these already. Just a reminder, you can find them on our page on the RBM website, as well as on Springboard, and we will certainly continue to share the links as we always do. Next slide. And a reminder also about the Malaria Evidence Database. This is a database that collects peer-reviewed publications with evidence about malaria SBC and the impact that it can have on changes to behavior or determinants of behavior. I would encourage you to use it in your work. You can filter by country or by malaria topic or type of study design. So it's a very useful resource when you are looking to find evidence to support your work in malaria SBC. And the Breakthrough Action Project maintains this database updated. We recently added new articles, including 2 that came out from Ethiopia that we were happy to see our former co-chair Guda as one of the co-authors. So what's nice about this database is that you may also see your colleagues published here. We very much look forward to continuing the conversation with you tomorrow. I think that's all we have right now for resources. So I'll now pass the floor over to Ashley to share some final instructions for tomorrow's virtual forum sessions and give us a closing for the day. Thank you, everybody. Thank you, steering committee and co-chairs. I look forward to speaking with you more tomorrow. Over to you, Ashley.
Thank you so much, Gabrielle. And thank you everyone for joining day 1 of the virtual forum, Maintaining Momentum. Again, thank you to our presenters and to everyone who has participated and contributed to today's conversation. We hope you found today's content useful and thought-provoking. We will convene again tomorrow at the same time with the meet and greet starting at 7:30 a.m. Eastern Time. Then presentations will begin at 8 a.m. Eastern Time to 10 a.m. Tomorrow's agenda includes 2 malaria SBC during COVID-19 presentations, tips on implementing SBC programs in conjunction with Zero Malaria Starts With Me, and updates from the Community Health Worker Toolkit workstream. We look forward to seeing you tomorrow. Again, thank you so much to all of our presenters. Please keep an eye out on Springboard for additional information, more questions, conversations. Our Springboard group can be found in the link in the chat box. Before tomorrow's virtual forum session, consider logging into Springboard and telling us what you found most interesting today, or share more information about the work you've been doing during the COVID-19 pandemic on malaria SBC. Finally, if you have not already joined our mailing list, please check the chat box for a link where you can subscribe. With that, we will conclude day 1 of the virtual forum, Maintaining Momentum. We will see you tomorrow at the same time, 7:30 a.m. Eastern. Thank you so much.